Too much of the hormone cortisol in your body causes Cushing's syndrome. Cortisol, which is produced in the adrenal glands, plays a variety of roles in the body. For example, the cortisol helps to regulate your blood pressure, reduce inflammation, and keep your heart and blood vessels functioning normally. Cushing's disease is a specific type of Cushing's syndrome. It occurs when a pituitary tumour causes the body to make too much cortisol. Cushing's disease is the most common form of the endogenous Cushing's syndrome, and it makes up about 70% of Cushing's syndrome cases. Another cause of Cushing's is over-medication with cortisone, primarily to relieve allergies. Most cases of Cushing's syndrome can be cured, though it may take some time for your symptoms to ease up. The condition is more common in women than in men, and it's most often seen in people aged 25 to 40. You may be more likely to get Cushing's syndrome if you're overweight or obese, if you've got type 2 diabetes that's not under control, or you have high blood pressure. You can check out my videos on weight loss, on type 2 diabetes, and on hypertension to learn about natural supplements and techniques that you can use to help to treat any related symptoms of this disease. People with Cushing's syndrome may see their face get round, known as a moon face. They gain weight in unusual ways. They bruise easily or feel weak, tired, and sad. Women and men may also notice fertility and other problems. My videos on chronic fatigue, mood disorders, and brain-boosting supplements may also help you to treat these common Cushing symptoms naturally to help to speed up your recovery. Changing the diet to a low carbohydrate diet, also known as a low glycemic index or low GI diet, and increasing the intake of magnesium and chromium has been shown to help horses who have Cushing's syndrome. Cells that are deficient in magnesium show impaired carbohydrate metabolism and a reduced insulin response. Chromium is also known as an anti-diabetic substance. In order to determine your dose of magnesium, slowly increase until side effects such as diarrhea or stomach discomfort are noticed. Then slowly reduce the dose until you can find the maximum tolerable daily amount of magnesium where no side effects occur. As magnesium is required for the proper functioning of around 300 enzymes in the body, profound benefits can be experienced after a few months of supplementation. Take magnesium as magnesium bisglycinate for best results. Zinc is also taken with magnesium as it's required by 100 enzymes, and therefore it may work synergistically by reactivating certain processes within the body. Typical recommended doses of zinc are 30 to 50 milligrams per day, but make sure to get a highly absorbable form, as some forms have as low as 20% bioavailability. Zinc's absorption, like vitamin C, can be increased with quercetin, which is found in elderberry juice. In Cushing's syndrome, the elevation of cortisol leads to a decrease in the blood levels of potassium, a condition called hypokalemia. Potassium is a mineral that helps the body to regulate fluid, send nerve signals, and regulate muscle contractions. Bananas are high in potassium. Due to regulations, you can't purchase a sufficient dose of potassium in supplements, therefore dietary sources would be needed to increase your levels. Vitamin D and calcium. Since calcium and vitamin D strengthen bones, doctors recommend a healthy diet rich in calcium and vitamin D for people with Cushing's disease. You can get a 25-hydroxy vitamin D blood test and then supplement accordingly with vitamin D3. Calcium from artificial sources may be dangerous. Calcium from dairy is not advised unless you can source raw milk, as this contains valuable enzymes and probiotics and does not contain acidic denatured proteins. Calcium and vitamin D also require vitamin K2 for its role in strengthening bones. Take 100 to 300 micrograms of vitamin K2 per day in the form of MK7 for the best absorption. In a trial, those who got vitamin C reported that they felt less stressed when they got the vitamin. The researchers believed that the vitamin C should be considered an essential part of stress management. Earlier studies show that vitamin C abolished the secretion of the cortisol in animals that had been subjected to repeated stress. The best form of vitamin C would be a liposomal vitamin C. You can Google how to make this cheaply in an ultrasonic cleaner. The next best form would be a non-acidic pH-buffered vitamin C, and the worst form would be a cheap acidic ascorbic acid. Vitamin C's action is improved when it's taken with bioflavonoids, again like quercetin and elderberry juice. Patients with endogenous Cushing's syndrome exhibit a remarkably high prevalence of primary thyroid disease. Resolution of hypercorticolism seems to trigger the development of autoimmune thyroid disorders in presumably predisposed subjects. Make sure that you support your thyroid function with nascent iodine and selenium. You can watch my videos on hyper and hypothyroidism for more information about balancing thyroid function. The association between the hypothalamic pituitary adrenal axis and sleep is well described. It's also known that the hypothalamic pituitary adrenal axis disturbances have an effect on sleep. In fact, patients who are affected by Cushing's syndrome often complain about poor sleep quality. Melatonin taken in the evenings can help to induce sleep. Any stimulants like caffeine or yohimbine should be eliminated from the diet. Sugar should be eliminated, as this also interrupts sleep. The research chemical SR 9009 was developed as a cure for jet lag, and this can increase energy and metabolism in the day. As it has a short half-life, its effects will wear off by night and it won't interfere with sleep. And thyroid support in the day can also help to provide daily energy while also not interfering with sleep. See my other video on herbs for sleep and my video on melatonin for more solutions. Exercise benefits the health from head to toe, so it's no surprise that it can help with stress relief too, possibly by reducing cortisol levels. Studies show, for instance, that exercise can bring down cortisol in the elderly and in people with major depressive disorder. Rather than depend on drugs that destroy the outer layer of the adrenal gland, there's natural remedies that can normalize the output of cortisol. Dandelion helps to normalize adrenal function. It's also an excellent tonic for the liver and the kidneys. Dandelion reduces inflammation in the body and also contains vitamins and minerals necessary for hair growth. Burdock is a cleansing herb that detoxifies the tissues and eliminates unwanted substances from the body. It's effective in balancing blood sugar levels and preventing diabetes. Astragalus, besides strengthening the immune system, it also aids in promoting adrenal balance. It additionally regulates blood pressure and blood sugar levels. And Tulsi, known as holy basil, can be taken as a tea to help to regulate cortisol levels. The supplement phosphatidylserine, also when dosed at 600 to 800 milligrams per day, can help to reduce cortisol, but it's an expensive supplement. In the small percentage where the adrenal tumour is malignant, additional natural measures should be implemented, such as inositol, curcumin, black seed or nigella oil, fish oil and flaxseed oil. Patients with active Cushing's syndrome had significantly higher serum homocysteine levels and lower folate concentrations than either the patients in remission or the controls. Take folate as metyl tetrahydrofolate. You can take B12, zinc, methionine and trimethylglycine, as they're beneficial for the folic acid cycle and for homocysteine control. GABA agonists can actually treat raised cortisol level in people who've been diagnosed with Cushing's disease or Cushing's syndrome. In a clinical trial using animals as subjects given high levels of theanine, which is a green tea extract, their cortisol levels were lowered and improved. The herb passion flower is also a good relaxing herb that increases GABA, as well as the supplement picamillan. Additionally, Cushing's disease has been associated with very low levels of taurine. Cushing's increases the risk of developing coronary heart conditions, while supplemental ingestion or the increased urinary excretion of taurine has shown an inverse relationship. Typical doses of taurine to supplement with are 1 gram taken 3 times per day. Curcumin can have many benefits for Cushing's disease, such as cortisol control and even slowing the growth of pituitary tumours. It's also a powerful anti-inflammatory. Typical doses can range from 2 to 5 grams per day. Due to its poor absorption, it can be enhanced if taken with bioperin, which is a black pepper extract, or with fish oil, butter, ghee, or coconut oil. In other animal tests, horses with Cushing's disease responded favourably to fenugreek, omega-3, EPA, DHA fish oils, and linseed. These may be easy to add to your diet, and they have many other noted health benefits. For more information about any of the herbs or supplements mentioned in this presentation, check out my website.